My name is Diane Ryan. I'm a staff nurse. I do direct patient care, and I love it.
Nursing kind of chose me at an early age of, say, 5 years old. My request for birthday gifts or Christmas gifts, I wanted a nurse's kit.
If you asked my siblings growing up, they'd say, oh yeah, she's always the one that wanted to pull out your slivers or put the Band-Aid on you.
I actually run into people today that are like, you're a nurse? You know, I don't know if they thought I was going to be in prison or what.
I remember the first day I went to school and it was a chemistry class. I came out crying. I hadn't the faintest idea what the man was talking about. And then every time I had a test, I would tell our residents and they'd pray, pray, pray. They'd pray the rosary. I got straight A's in chemistry.
You need to know the science and understand the science. I think that's what makes for an excellent nurse. But the other part of it, that's why nursing is an art and a science, is because you got to be there to connect with the patient, to make sure that they're okay.
I went in to be a nurse because I just felt like I was good for it. You're in a Johnny in a bed and you've got tubes in you and you're dehumanized. And I feel that, you know, what a nurse has an opportunity to do is go in and kind of normalize that so that you don't just become a part of all the machinery.
I had a head-on collision and I was in a wheelchair for a long time. And I found out what it's like to need care, you know, to be helpless. And it wasn't good.
When I was younger, I was sick and in and out of the hospital a lot. The feeling that I had when the nurses took care of me, that's what I wanted to do with somebody's life.
And that was one of the moments I realized that I wanted to be a nurse. I wanted to be at the bedside, communicating with the patients.
It really comes down to a conversation, right? And understanding what that person needs.
And that's the part of being a nurse that I love, that I can sit down next to the bed and have this conversation with them.
If I can build rapport with my patient and I get you to smile, I get you to laugh, that makes me come back every single day.
When you have those moments, those good moments, it's something you'll never get anywhere else.
There's something for everyone in nursing, the whole spectrum from life to death and everything in between.
As soon as somebody said, there's a trauma coming in, it's like your juices, you get excited because that's an opportunity to save a life.
A lot of people just think, oh, you just deliver babies. But I think it takes a certain kind of nurse to have those nerves and be able to stand up and say, we're going to do this together and we have to get this done and you're going to be able to do it.
So far, I've chosen to be a nurse and a soldier. It's just who I am. And it'll be who I am even after I hang that uniform up.
There's a purpose for me here. They're here during their time, and I'm not here to judge them. I'm here just to take care of them.
If I can give these people just that one bit of dignity, that one bit of hope, I did my job. I'm good.